Good morning, everyone. How are we doing? Good morning. All right. All right. Everyone have their coffee. They're ready to learn some good stuff. All right. Me too. So, welcome to the Lifestyle Lab. This is, look, I always say longevity is doing, right? And that's why I was really excited to host this Lifestyle Lab because lifestyle, when we look at, we're going to have some great speakers talking about sleep and things related to diet, some frameworks and protocol. I mean, you know, it is living, it is a lifestyle, taking all this information and plugging it into your lifestyle. So, super excited about it. I think this is very valuable. I'm personally I view longevity in this regard. I'm always looking at, like, how do I make this a lifestyle so it takes no cognitive expense out of me? It's just habit. It's like brushing your teeth, right? We don't have to have a discussion with ourselves. We just do it. And then when you don't have this cognitive expense anymore because you have this lifestyle, you can stack hundreds of habits on top of each other. And then someone looks at you and goes, how are you able to manage all this? It's a lifestyle. That's how I do it, right? So, very excited. Our first speaker today, we're going to be talking about sleep. He is Dr. Sahil Chopra MD. He is a distinguished physician specialized in sleep medicine, pulmonary and critical care, and internal medicine with training from Harvard, Loma Linda, and UCLA. As Chief Medical Officer at Empower Sleep, he has pioneered an innovative sleep care solution that harnesses continuous health data to personalize and scale precision care. By analyzing hundreds of thousands of sleep hours, his approach significantly enhances patient outcomes. His research focuses on the intersections of sleep, longevity, and vitality. Outside of his professional endeavors, he is a dedicated father to 3 children, so he knows something about sleep and managing children and enjoys road biking. So please give a warm welcome to Sahil Chopra.
Good morning, everybody. Can you hear me in the back? Oh, nice to see you all. Um, I'll just sort of jump right in. What do you guys see? Pardon? A sleeping car, yeah. You guys are aware, and you know the distinction of a parked car versus a charging car. And it's a extremely important distinction to make. If I told you that during the process of charging this car, somebody was coming in and vacuuming the inside, the front trunk, the rear trunk, putting on a layer of tread over the wheels, topping off the windshield wiper fluid, and like all of these tiny processes, that would be really cool, but that technology does not exist today. But when we sleep, when humans sleep, there's a distinct difference in not just are we charging, but there's a whole host of micro processes that are happening during that period of time. In the brain blood flow to the brain is the highest at that time. Beta amyloid is a precursor to Alzheimer's disease. That is being filtered out of the brain during stages of deep sleep. During sleep, blood pressure dips. That's healthy for our cardiovascular system. During sleep, growth hormone is supposed to rise. If someone doesn't sleep, that doesn't happen. During sleep, melatonin levels are supposed to rise. Temperature is supposed to drop. We're supposed to build a new layer of epithelium over our GI tract. So there's a whole bunch of tiny processes that happen when we sleep, but they do not happen when we are resting. So if the process of sleep is broken, for whatever reason, they have insomnia, they have sleep apnea, they have restless legs, anything, or they're being interrupted many, many times an hour, or the duration is short, well, guess what? No wonder people who have poor sleep have a whole host of downstream consequences. Hypertension, diabetes, cardiovascular disease, dementia, anxiety, depression, and the list goes on and on. So I'm here to talk to you guys about one thing, and that is that sleep is the foundation of your health. And I'll start off with this beautiful quote, and I'll read it out to you. If sleep does not serve an absolutely vital function, then it's the biggest mistake the evolutionary process has ever made. And you guys are all aware that evolution does not make mistakes. So if evolution has designed us to consume sleep during hours of darkness, during creating our most vulnerable state, there has to be a very strong evolutionary reason for us to do that. We have some understanding of sleep over the last 30 years, but it's still the tip of the iceberg of where we're going. Thank you for the intro, so I'll skip this. So let's talk a little bit about sleep and this idea of longevity. And what I want to introduce you to is this U-shaped relationship. On the bottom, we have sleep duration. Who's heard of this idea of like 7 to 9 hours of sleep? Right? We all have we're somewhat familiar with that. But what you get to see is when you have sleep duration plotted on the x-axis, and you have risk of developing either all-cause mortality in men or cardiovascular disease in men, and this is coming out of over 300,000 individuals in Southeast Asia. You get to see this U-shaped relationship where the people who sleep too much or people who sleep too little, they're at a higher risk of all-cause mortality. They're at a higher risk of cardiovascular disease in men. And this is not small, few hundred people trials. These are reproducible, replicated trials in hundreds of thousands of individuals. And then this can also be looked in a more granular way, where that same relationship of too much sleep or too little sleep has a much higher risk of developing hypertension. There's a much higher association with major depressive disorder, anxiety, dementia, and diabetes. And these are from Nature, from JAMA, from reputable high impact factor journals. And this is a reproducible, repeatable phenomena that we see over and over again. And what this essentially confirms over a decade's worth of research is too much or too little sleep is associated. In medicine, it's always hard to have a causal relationship. What causes what? But what we know for sure is if someone sleeps too much or they sleep too little, those individuals are associated with a much higher risk of developing all of these conditions that I talked to you about. And if we think about that, what starts to happen is you start to realize that sleep is really the foundation. We can do all sorts of unique gymnastics about longevity, but if our sleep is broken, then all of these things may not be as effective. If we ask ourselves the question, so why is that the case? Why is it that too much sleep or too little sleep is associated with all these different problems? You start to open up a whole bunch of different hypotheses. You open up this idea, is it the timing problem? Is it a duration problem? Is it a quality problem? Is it our lifestyle? Or is it like these different diseases that are rampant in today's population? Sleep apnea affects 10% of this room today. Insomnia affects about 10% of this room today. Restless legs affects about 5 to 6% of this room today. And these are sleep disorders and conditions that need to be treated so that one can get back to physiologic sleep. And if we just take sleep apnea for an example, we have survival probability starting off with 100 and years of follow-up. This is about 1,100 individuals. And what you see is people who have sleep apnea and insomnia, there's a faster decline, there's a lower survival probability as compared to those who are in the healthy cohorts. But those who have both, look at this drastic difference. People who have comorbid obstructive sleep apnea with insomnia, there is a substantial difference in this curve versus the cohorts of individuals who just have sleep apnea or insomnia. This is also true for circadian rhythm problems, and let me walk you through this graph. This is about 60,000 individuals out of a UK cohort. This is basically actigraphy. It's a graph of activity. You have sleep timings on the bottom and days. So this is 1, 2, 3, 4, 5, maybe 7 days of data. So this is someone who has a consistent sleep schedule. This is someone who has an inconsistent sleep schedule and taking naps during the day. And now you have someone who has a completely wild sleep schedule. This is someone who has likely a circadian rhythm disorder. And we see this often, at least in the retired population, where they're sleeping all over a 24-hour period. And what you can see is individuals who had higher sleep regularity, the overall all-cause mortality is about 20 to 50% lower. Risk of cancer is 16 to 40% lower, and cardiometabolic mortality is also lower. So this idea of like, hey guys, go to bed on this time and wake up on this time, it's not like, it sounds really silly and it sounds really basic because we do this with our little kids, but if we look at the data, it becomes really compelling that having a consistent or an entrained circadian system is critical for our overall well-being. And this is also true for restless legs. People who have restlessness in their legs when they're trying to go to bed, about 7,300 individuals. And people who have restless legs, this graph here, versus people who don't, you can see that the probability of survival is lower with people who have a sleep disorder like RLS, and almost a 4 times higher likelihood of developing cardiovascular disease and strokes. And what happens in RLS is not just one has this urge to move their legs, but their brain wakes up many, many times an hour. And this sympathetic response happens hundreds of times during the night over many decades. And if sleep is designed to be a parasympathetic predominant state, and it's in a sympathetic drive the entire night over decades of time, you can start to imagine now why all of these disorders result in the consequences that they result in. You know, as a clinician, I always like to dabble into the details of things, and the question is always like, does the severity of a problem make a difference? And the short answer is yes. If we look at people who have symptoms of insomnia, again, looking at all-cause mortality, about 1,500 patients, people who have persistent insomnia are fundamentally different than people who have intermittent insomnia or who have never had symptoms of insomnia. So individuals who are on Ambien, Lunesta, clonazepam, trazodone, or using any over-the-counter Benadryl, doxepin, any kind of cocktail, if these conditions remain untreated or we don't find out the root cause of those problems, the cumulative survival is substantially lower, and there's no question about this. The same thing is true for sleep apnea. People who have severe sleep apnea versus people who have mild sleep apnea, you can also start to see a distinct difference when you look at these people over a 30-year window. And the same thing is true for RLS. People who have RLS symptoms over 15 times a month versus less than 15 times a month, versus no RLS, overall mortality is substantially higher with severity of disease. And then the second question becomes like, what if I do something about this? What if I have sleep apnea, I have insomnia, I have RLS, my sleep schedule is all over the place, my lifestyle around sleep is not conducive to sleep? What if I do something about this? And this is where this whole idea of like longevity comes into play, because treating sleep apnea changes survival substantially. Untreated sleep apnea, treated sleep apnea. Look at the cumulative risk of survival. 4,500 patients looked over 15 years out of the UK. So if someone has sleep apnea, like we should treat this. In this study, they looked at, who's familiar with a CPAP machine? So many of you are. It doesn't have to be CPAP. It just has to be treated disorder. And the same thing is true for restless legs, and the same thing is true for people who have symptoms of insomnia. So living with a sleep disorder, I was just talking to Stephen, people take pride in like not being a good sleeper. That's fundamentally wrong. My goal today is like to help you guys change that. If there's anyone in this room that takes pride in the idea that I'm okay with living with poor sleep, or I'm okay not sleeping well, or I take pride in sleeping less, and I am someone who did this in residency and fellowship because we worked 70, 80 hours a week. But this, it's so pathologic from a physiologic state that it makes no sense to live that way. So let's talk about this idea of how do we assess our sleep health. Like I see people wearing Garmin's, Whoops, Oura rings. All of these like consumer grade devices are super helpful. They have completely changed the way how we interact with our physiology. And having these metrics and these data points are super intuitive and useful for us to start seeing what happens to our physiology over time. And the traditional way of looking at sleep is by going into a sleep lab. And it's an extremely powerful tool. During this time of doing a sleep study, you're measuring sleep on the scalp, you're measuring breathing, you're measuring chin tone, you're measuring respiratory movements, abdominal movements, heart rate, oxygenation, motion. You're able to measure arousals. You're able to get all of this beautiful information. But the problem is it gets done in a lab. So it's kind of an awkward environment where people's sleep is not the same as if they would be sleeping in the comfort of their home. And with these wearable devices, this is mine from maybe a few weeks ago, but you start seeing how powerful one night of data, although very high resolution, may not be as useful as longitudinal data that is not of the highest resolution. But the exciting thing is now we have the ability to get high resolution data in the comfort of someone's home. These are longitudinal home sleep testing devices where you wear a ring, essentially. Software will analyze these sleep biomarkers similar to how things are analyzed in a lab. And you'll get feedback every morning on what was your sleep like. How many apneic events did you have per hour? What was your objective sleep quality? How much movement did you have? Is your sleep apnea during REM? Is it during non-REM? And if you create this closed feedback loop system over a period of time, what ends up happening is you can learn more about your physiology. If you're connected to a physician, a board-certified sleep specialist, they can give you real-time recommendations on what to do, what not to do. Who's heard of the idea of mouth taping? Mouth taping or using like nasal strips to sleep? Yeah. So in a traditional setting, anybody who has mild sleep apnea would have gotten like a CPAP machine. We have shown that 30% of people who have mild sleep apnea, their sleep apnea disappears with just mouth tape. If you can retrain somebody to breathe healthier through their nasal passages, and you reduce resistance in the nasal passages, and you help them keep their mouth closed, their breathing is more physiologic and farther away from sleep apnea than is if they breathe with their mouth closed with an obstructed nasal passage. So when you have longitudinal data, you can do these different unique experiments to see what's working, what's not working, and help these individuals build a stack of solutions that is personalized to them, that helps them solve their problem so they have a solid foundation of better sleep. Here's just an example. 55-year-old individual who, one of our patients, when they came to us. So what you see in this bar graph is apnea indices, and this person had about 91 pauses in breathing per hour. That's essentially like once every 45 seconds. This purple, and so you have time. This is a 90-day sleep testing window. We have time on the x-axis. The bar graph is apnea indices. The purple line graph that you see is sleep quality. And these are sleep stages. And the dark blue is deep sleep. You see that there's no deep sleep here, essentially. And once we put these individuals on CPAP, or at least optimize their sleep, over a period of time, what you start to see is sleep quality starts trending up. Breathing is more physiologic. There is much more deep sleep than there was before. And the idea is to use biomarkers from an individual to help them get to better sleep over a period of time in the comfort of their home. Here's another example. We talk about the relationship of sleep and mental health conditions. These wearables can give us such unique insights. This is a 55-year-old who, at baseline, has mild sleep apnea, decent sleep quality. When he went on vacation, he's on mirtazapine for major depressive disorder, prescribed by a different individual. On vacation, you can see his sleep is pretty amazing. There's no sleep apnea symptoms, or there's no sleep apnea physiology going on. And when he comes back from vacation, you can see how the overall baseline of his sleep quality is substantially lower. Mood is lower, sleep is lower, and this sort of introduces us to this idea that sleep is a window, is like an 7 to 9 hour window into someone's physiology. By looking at someone's sleep across time, we can identify arrhythmias. We can identify how is their physiology changing over a period of time to prevent conditions in the future. Through sleep, we can predict someone's brain health. Through someone's sleep, we can predict their overall cardiovascular health. All of these things are coming. We're not there yet today, but these things are in the pipeline. So I wish there was like a magic pill to help people sleep better, but healthy sleep is really just a byproduct of a whole bunch of different scenarios, circumstances. One is our circadian system. Ensuring that there is darkness during night hours and daylight during daylight hours, I cannot emphasize the importance of this. The circadian system is what regulates our biologic clock. If the circadian system is confused all the time because it's getting signals of daylight during hours of darkness, our circadian rhythm will always be confused and we will never feel rested. Other things to just be cognizant of is if we want to make sure someone's general health is as restored as possible. Any chronic conditions, any chronic pain. There are medications that, sometimes when we go through a medication list, there's this idea of polypharmacy. There's so many medications on this list. Some of these medications themselves are causing symptoms or worsening of someone's restless leg syndrome or insomnia or any of those conditions. We want to help people build healthy behaviors, daytime routines, nighttime routines. Just like we become intentional about our day, like we wake up, brush our teeth, take a shower, have a cup of coffee, whatever that routine is, there is some intention, some routine that we have. If we can just build a similar routine of the night, it changes the game. Give it 6 weeks. It's not something that we need to do. Usually it's just a whole bunch of stuff that we need to eliminate. because there's so much noise that's going on in the evening hours. These routines are so critical. Mental health, like we have a lot of case studies now of showing just the incorporation of a breathing exercise prior to bed changes the amount of deep sleep people have. Breathing modulates our parasympathetic nervous system. Parasympathetic nervous system is a driver of healthy sleep. So just by incorporating these small things can be super powerful. And if somebody has a sleep disorder, like sleep apnea, restless legs, that is the lowest hanging fruit of improving your quality of sleep. And then there's also these other things that we're all sort of aware of when it comes to like our environment from a temperature, humidity, bedding standpoint. And lastly is where I think supplements play a role. Supplements should not be used as like the first tool to improve sleep. Supplements are the last thing that we use. We need to fix the foundation. We need to fix our habits. We need to make sure there's no sleep disorder that is causing bad sleep. And if all that has been done, supplements can be stacked to the equation. So healthy sleep, as I mentioned again, is like a byproduct of this iterative process and journey of going from not so healthy sleep to healthy sleep by understanding how do these different things influence my sleep in a different way, eliminating those that don't serve us, eliminating the things that are not conducive to sleep, and incorporating the things that are conducive to sleep. Thank you. One of the functions of so the question is, how do peptides influence a calcifying pineal gland, and like how does that help sleep? So one of the functions of the pineal gland is to secrete melatonin. Melatonin, if you look at the pathway of how melatonin is secreted, darkness hits the back of the retina, it passes through the suprachiasmatic nucleus, eventually sends signals to the pineal gland to produce melatonin in the brain. Melatonin is produced in the brain and it goes to all the different peripheral receptors, the melatonin receptors in the different organs, to tell them that we need to shift from the process of daytime to the process of nighttime. So I don't have experience in like using peptides in this context, but what I would recommend to do is we can just check someone's melatonin production. It's called the melatonin profile. It's a 24-hour salivary assay where you just check how much melatonin is one producing over a 24-hour period. And if it's low, I don't know if giving peptides would help, but we can measure the effect of peptides 3 months later. But an easier thing is, let's just give you some, like a low-dose melatonin. It costs, $5 on Amazon. And let's see how that influences your melatonin profile. Because the whole game of melatonin is to modulate our circadian rhythms. And if circadian rhythms are healthy, then sleep can be healthier. Yes, sir?
What do you think is the most accurate device? I'm just going to repeat the question so we have it in there. It's working? Yeah. What is the most accurate wearable device on the market, in your opinion?
That's a difficult question. They all use different algorithms to estimate someone's sleep. They do it similarly using the heart rate signal. And none of them are, in a healthy individual, they're all very similar. When someone has any pathology of sleep, they're all going to be very dissimilar. And what I recommend to patients is don't get too focused on the exact absolute values. Let's look at the trends. The trends are way more powerful than what are the absolute values today. If someone has horrific absolute values and they have symptoms that suggest a sleep disorder, I'm going to just do a sleep study. I'm not even going to bother using this information to try to figure out what's going on. Because if any number is off, we need to figure out why is that the case. So if numbers are so I'll just repeat, if absolute values are horrific and someone has symptoms, I would just jump to a sleep study. But if someone is just curious about what kind of a wearable to use, they're all very similar in the setting of the absence of disease. And find a form factor that fits you best. Some people don't like rings, some people don't like things on their wrist. So just see what you like and pick one accordingly.
So a couple different other speakers from yesterday and the day before were talking about how healthier people potentially need less sleep than others, so like 6.5 hours. What are your thoughts on that?
That's a possibility. So the question is,
real quick, sorry, I just want to make sure that we're recording. The question is, if the healthier you are, do you actually need less sleep? Some people are actually saying 6.5 hours for really healthy people.
it's a possibility. There are case reports of like yogis who have just mastery over their autonomic nervous system, and they can function and do really well and have a profound level of focus even with very little sleep. And so I think it's a possibility. And then when you say healthy, it's mental health is a big, our autonomic nervous system health is probably a big component of that. But I do think it's a possibility.
I often meditate or take a very short nap in midday, and of course that shortens up my nighttime sleep. And I find that's very good combination for me, but it's always disrupted because society doesn't really allow for midday breaks like that. But anyway, what's your take? You mentioned meditation in there. That doesn't usually happen at night, that usually happens in the day, and I just thought maybe you could elaborate.
So what is the effect, positive or negative, on meditating in the middle of the day, or even maybe napping in the middle of the day, on total sleep quality?
If we look at the idea of napping, there's a physiologic dip in our circadian alertness that happens to all of us. It's somewhere between 12 and 4, depending on where someone's biologic day is. So that physiologic dip in alertness, if you choose to take a nap, that's okay. There's nothing wrong with that. The problem is if it is making it harder for you to sleep at nighttime. If naps make it more difficult for you to sleep at night, or your sleep is shorter, or it's not as consolidated, the lowest hanging fruit is to eliminate the naps. And you can meditate anytime. I mean, the whole idea, I think, of meditation is not to meditate, but to become meditative, like over a period of a 24-hour period. And just reminding yourself of meditation is a practice to do that. So, yeah, that's how I would sort of answer that.
So changing your circadian rhythm, how can you do that effectively? Reading about this and not understanding.
So how can you change your circadian rhythm? How can you alter it?
Let's take a step back. Let's take a step back, and like circadian rhythms are essentially the rhythms that entrain our 24-hour period. We have a biologic day and we have a biologic night. This day and night is influenced by light and darkness, as well as food, as well as exercise. These are and genetics. These are like 3 or 4 big things that help us maintain our circadian rhythms. Moving circadian rhythms forward or backward, like jet lag, adjusting the jet lag is essentially an adjustment of our circadian rhythm. We have to know where we started. So if I'm someone who is a night owl and I easily fall asleep, I have a hard time falling asleep at 10 p.m., but I can easily fall asleep at 2 a.m., and I like to sleep in until the morning time. So I can then start to estimate maybe I'm a 2 to 10-ish type of, that's my biologic night. So moving it earlier is essentially moving our clock, moving our sleep zone, our darkness zone and our light zone, about 15 minutes every couple of days, with a lot of light in the morning time intentionally waking up 15 minutes earlier every 3 to 4 days, and perhaps taking a low dose, it's called a circadian dose of melatonin, 0.5 to 1 milligrams about 10 hours before your goal wake up time, to sort of prime the body for the processes of nighttime while maintaining a night environment. Like if someone's going to take melatonin and then watch a whole bunch of television or play a video game, that's the sympathetic arousal of that is way more powerful than that of a low dose melatonin. So they can move. We just need to know where they are, and darkness at nighttime, daytime during the daytime will help shift this in whatever direction you want to.
I am not waking up at 6 a.m. I'm a night owl. I cannot sleep.
We should do
What's the
sleep-
question?
Well, I'm a night owl. I've always been a night owl. But now that I'm older, I'm waking up at 6 o'clock and cannot go back to sleep. But some nights I'm not going to sleep until 1 or 2 in the morning.
Yeah, so with age, some people seem that their circadian rhythm gets thrown off and that what they used to be able to do is now altered, right? I actually, in tandem with that, are there certain people with chronobiologies that maybe their genetics, they stayed up late at night to watch The Village to make sure no attackers came, and then their children did the same thing and their children did the same thing, so it's in their DNA to actually have an altered circadian time that's not normal to light and dark?
That's definitely a possibility. But so with age, the amplitude of our biologic day and biologic night, they change. Even as we age, how much temperature drop we have during sleep is lower as we get older as compared to a younger individual. So there is a process of aging for our sleep that happens. But if there is an abrupt change, we're just assuming that this is age. And I don't think that's a healthy way to think about this. So I would do a sleep study to ensure that there is no pathology of sleep, and this is purely just a circadian rhythm problem, because sleep disorders are so common. It just makes sense to make sure that's not playing in the equation, because that will completely change the management.
Okay, we have to wrap it up.
Yeah.
Let's give a welcome to our applause to Dr. Chopra.
Thank you.